This is INN News with a special report. This is INN. I'm Penn Holderness, and we've got breaking news. A potential deadly flu outbreak in Shanghai, China. More information.
Oh my goodness, a potential flu outbreak. Who would have thought? And President Broadhead hospitalized in Shanghai. Gosh, what might be going on here? Well, I'll tell you, it's a good thing we have Dr. Shukit from the CDC who might help us understand what might be happening. Dr. Shukit.
I'm Dr. Ann Shukit. I'm from the Centers for Disease Control and Prevention, where I'm the director of our National Center for Immunization and Respiratory Diseases. I'm delighted to get to be part of Pandemic 2011. I have to say, though, when I walked into the building and saw the sign, Pandemic 2011, I thought, oh no, I don't want to have another pandemic this year, because pandemics are really difficult. Obviously, they're a huge loss of life and disabilities and a huge infrastructure responding to this amount of illness. But of course, it's so important for us to be prepared. So I think it's wonderful that the college is putting on the forum and that so many of the college students will get to be part of this, because we don't have all the answers. And I hope in these groups that the students will be working on, some creative ideas will come together.
At first we get together and they lecture us about a certain type of thing, and then we break off in our groups and we're able to just talk about it on our own, and then we convene back and then discuss, and the different viewpoints that come from everywhere is just really interesting.
Something really cool that we did today was when we broke into small groups, we talked about the different ways of rationing healthcare in situations where we have limited supplies for vaccines and things like that. And we had some really valuable discussions and got to see really different ways that governments do that rationing, and I just thought it was fantastic, and it was, really insightful.
I thought that was really cool, like how everyone kind of came together and cited different evidence and stuff. So I definitely think this was a great experience.
Throughout history, there have been pandemics, from the Black Plague to cholera outbreaks to the H1N1 pandemic. There are many implications, there are many lessons that we have learned, there are many problems that we have to think about in the future.
Winter Forum, Pandemic 2011. Are you ready?
When I heard about the theme of this year's forum, I was intrigued because I think pandemic awareness will be a critical part of the next century.
I was interested in the Winter Forum because I went abroad this summer to Uganda, and it really got me interested in global health, and I thought this would just teach me more about it.
I thought it's a really cool chance to interact with people both across majors and across years in a way that you wouldn't get to normally. It's interdisciplinary, so even though I'm not pre-med, I'm getting exposed to things that I don't get to take, subjects that I don't get to learn about in classes. I'm really enjoying it so far.
My favorite part of the Winter Forum has been just basically the diversity of opinions people have shared, and then the expertise has been shared by the professors and the speakers and all, and it's really how people have been providing, different viewpoints. It's really, gave a lot of food for thought. So that's what I enjoy about the Winter Forum.